Welcome, everyone. I'm delighted that you've joined us in person and online this evening for our event at the Royal College of Physicians. My name is Gail Chapman. I'm the Public Programmes Officer here for the Archives, Heritage Library and Museum team. Quick bit of housekeeping, just to say we're not expecting a test on our fire alarm, so if it does go off, we shall usher you out and head out the fire exits, and we'll just gather on the cobbled place in St Andrew's Place, but hopefully that will not be an issue this evening. So tonight is the final event for the Fortitude exhibition run, which explores healthcare workers' experiences of the COVID-19 pandemic. The exhibition looks at this through objects, photos, written accounts, and oral history interviews. If you haven't had a chance to go look at it in person, please do. It will be open until the 18th of July, but then it's closed to in-person visits. It is, however, online as well, so our website will continue after that, and all of the material is part of our permanent COVID-19 archive. Let's just click on. For this evening, we've invited back 4 of the doctors who contributed interviews to the exhibition for a live discussion led by our oral history officer, Sarah Lowry. We are hugely grateful to them for giving their time for this evening. The doctors are from across England and both southern and northern England, thankfully. We've got a few folks from all around. And the memories they shared about the first months of the pandemic will be explored and how they feel now looking back and what has changed in the years since. It is a very emotive topic, so if at any point anyone needs to step away, that's absolutely fine. There's our open space in the Lasden Hall, our sensors room and park room are also both empty this evening, so please feel free to take a moment if you need to. But before we get into the discussion with our doctors, I would like to invite our exhibitions officer, Sarah Backhouse, too many Sarahs tonight, Sarah Backhouse, to give a short introduction to the COVID collection and the exhibition.
Thank you, Gail, and good evening, everybody. Thank you very much for coming this evening. So yes, as Gail said, before I hand over to Sarah and our speakers, I just wanted to give you a little bit more background about the Fortitude exhibition, which I hope, if you haven't seen it already, you will have a chance to before it closes. Now, hopefully this will work. Okay, so in January 2021, we, the Royal College of Physicians Museum, created a survey to collect and record the experiences of RCP members and other healthcare professionals working during the COVID-19 pandemic. And we received an overwhelming number of written testimonies, recorded oral histories, objects and images in response to our survey. These responses came from trainee and junior doctors, GPs, nurses, consultants from over 20 different medical specialties. We were really delighted. But each response told a story of lives that had been very transformed by the pandemic. So we also received many quotes that followed along these lines. I'm just going to read this one for you. I hope that the sharing of our experiences can help people to glean some further understanding and show some greater compassion for all those that have toiled, sacrificed, and suffered in the last few years. Though it may be difficult and they may want to turn away, I hope they don't, so that we can all build a deeper understanding of what so many like me have experienced in the healthcare profession. And below is another quote that I shared during the exhibition launch last September from a junior doctor in Scotland. I hope that we are listened to after this ends, not called heroes or angels or clapped for or given badges or medals, listened to. Now, a repeated concern for the healthcare professionals who took our survey was that their stories would be ignored or forgotten and lessons would not be learned. And we realised that simply collecting these experiences was not really enough. They needed to be shared and to be heard, and thus the Fortitude exhibition was born. I should say at this point that I'm not a medic, and my experiences of the pandemic were very different to the ones that you will be hearing about this evening. And I found the task of creating an exhibition from these very, very profound and powerful human emotions to be quite overwhelming, because how could we possibly do justice to these stories and to what our healthcare professionals have been through during this time? And we were quite relieved to have received some very nice feedback from the exhibition, and I hope that you don't mind me sharing a little bit of that with you. So importantly for us, the feedback showed us that visitors were doing exactly what we hoped that they might do, which was to engage with the stories and come away with a deeper understanding of what our healthcare professionals had experienced during the pandemic. It made me feel even more grateful to the men and women who were on the front line during the pandemic, astonished by the relentless hours they worked. They deserved every penny they get for the trauma they suffered. Reflective, moved, thankful, sad but uplifted, and in awe of the work and strength of the healthcare workers. And I think we all agree 100% with these comments. Having the exhibition here in the building, and walking past it so frequently, seeing the images on the walls, the objects in the cases, it's impossible to not stop and reflect and think about these stories, and to empathise with the people who very bravely and honestly shared one of, or perhaps the most difficult periods of their lives with us. I almost kind of feel like the exhibition has developed a life of its own. It has a presence within the building, and it carries with them a very emotional journey, reflecting every single one of the people who contributed to it. Very important to share these experiences so people understand what the NHS and individuals went through and the lasting trauma. The exhibition is interesting and helpful to make us remember what healthcare workers went through. Thought-provoking, a real solid memory of a difficult and emotionally draining time for medical staff and all NHS staff, patients and families. So what this feedback shows us is that our visitors also share our understanding and appreciation of the importance of sharing stories and the need to preserve the memory of these experiences. So my hope is that as the exhibition comes to a close, we do not stop listening to our healthcare professionals. Our collecting project will remain open indefinitely, and we will always want to hear about your experiences because we really feel that this is the least that we can do. And this is the website you need to visit if you would like to contribute to our survey. So on that note, I would just like to say that none of what we've created here would be possible without Sarah Lowry, our oral history officer, and also the amazing people that she interviewed. So I'm going to hand back to Gail now. He's going to introduce our panel, and then over to you. Thank you very much.
Thank you, Sarah. So we're now going to move on to the discussion part. So I'd like to invite up our speakers. I'll just give you a little bit of information about who they are this evening. So first, Dr. Catherine Monaghan. If you'd like to come up and grab your seat. So Catherine worked as a consultant in acute and respiratory medicine in North Tees and Hartlepool from 2013 to 2023, and in the emergency assessment unit in North Tees throughout the pandemic. She's currently one of the medical directors in the North East and North Cumbria ICB, as well as the clinical lead for virtual wards for NHSE in NEY, and still works as an acute physician in North Tees Emergency Assessment Unit. And next we have Dr. Ajitha Jayaratnam, a consultant in respiratory and general medicine at West Hertfordshire Teaching Hospitals NHS Trust. She is the clinical lead for TB and the trust director for clinical governance. During the first COVID wave in March 2020, she worked in the emergency department and the respiratory wards, and was also the associate divisional director for medicine at her hospital. And next we have Dr. Tuke Lok. Tuk has been a respiratory consultant at Maidstone and Tunbridge Wells NHS Trust since 2017. Prior to this, he was appointed consultant physician at Croydon University Hospital, formerly Maidie, in 2007. In his spare time, he enjoys playing the piano and violin. An avid runner, he completed the London Marathon in 2011, hopes to do it again. And finally, we have Dr. Laura Jane Smith, who works as a respiratory consultant at King's College Hospital in London. She was in her first year into being a consultant at the start of the pandemic. Has a lot of diverse interests within and without her career, including crochet. Those of you who've seen the exhibition may recognise her work. And to host this discussion this evening, we have Sarah Lowry, our oral history officer, and I'll now hand over to her for the rest of the evening.
Thank you. Can I grab the clicker? Yes, thanks. Well, thank you very much for coming, everyone. I just want to give a little bit more of an introduction to the oral histories at the Royal College of Physicians. We have about 250 recordings in the collection, about 35 of which focus solely on the COVID-19 pandemic, and really grateful to everyone who gave an interview for that. The interviews about COVID are about 1 to 2 hours long, and they were almost all recorded online. So I do apologise about the sound quality isn't as perfect as I would like it to be, but it's a reflection, obviously, of the pandemic times that the sound quality is a little bit compromised. So all the audio in the exhibition upstairs and for this presentation comes from those COVID-19 interviews. Oral history as a historical source is not very good on facts and figures, but it is very strong on the emotional response. And so the panel discussion today does really focus on what, as a physician, it was like to work through this time. So with that in mind, we'll move on, I hope, to the first quote, which is from Catherine's interview. Unfortunately, take ourselves back to the spring of 2020, and the news of COVID-19 is spreading across the world, and this is Catherine's reflection on that time.
Apprehensive, scared, but not for myself. I can't really say why I wasn't scared for myself. Excited is the wrong word, but nervous excitement, that kind of feeling of being ready for something, not quite sure what was coming, not quite sure how hard it was going to hit us, a bit of a torn sensation really of, oh, we're probably overreacting, to I really don't think we're overreacting, I think we need to be moving quicker. I think one of the most striking things was the absolute plummet of general medical admissions. It dropped off incredibly rapidly, and within the space of probably about 2 weeks of me seeing the first case, the whole ward was red, and that was all we saw. We only saw COVID. It was just really quite scary. I'd gone home on the Friday, you could feel everything really revving up, and then by the Monday the whole ward was red and all we saw was COVID, and even patients who you thought might have had something else didn't. The punchline was COVID, and I just thought, wow, this is it.
So, Catherine, you did this interview in April 2021, yeah. So just post, well, coming towards the end of the worst part of the second wave. And I just wondered if you had any reflections on this now, on your words now, and also just whether, you know, anything in your career had prepared you for the moment when the whole world turned red.
So the first reflection I've got is that we're probably overreacting. Didn't age very well. So it was really, really strange. You could feel it coming. You could feel it coming through Italy. We had colleagues in Italy and we were trying to get information from them as to what it was like. How would we recognise it? And then it just came and that's all you saw. And I remember a ward round in the first week and I was quite despondent by the end of it. And the junior doctor said, we've got a frail lady in room 9 and she's coming from a care home and she's got a UTI. And I went, excellent. And they went, oh, but she's got COVID as well. And it was just, I don't know, I think that really made me think, oh God, this is really, really, really bad. Nothing in my career had prepared me for this. So I wasn't new like you were. That must have been really stressful. I'd been a consultant for about 7 years, but nothing had prepared us for it. It was just so tough, and all those planning meetings, and I kept thinking, we just need a bit more time, we need a bit more time. But the virus didn't give us the time, did it? We just had to deal with it as it landed.
Thank you very much. Would anyone else like to comment, or does anyone else have a kind of, wow, this is it moment? Yes, Laurie.
Yeah, so I had a couple of those moments. So one was when COVID actually hit England and London in particular, because London sort of got it first. I was actually in Japan, so my partner was working there on a contract, and I'd gone out for a week's holiday. And as I flew into Tokyo, they shut all the museums and schools, and I thought, oh, okay, this is real now. But I was then there, kind of messaging colleagues frantically, saying, "Is it hit yet?" And it hadn't. And just as I was flying back, they were like, "Okay, it's here now." And then the second moment was, I was in a consultant meeting. And most of our consultant meetings at that time, various issues were discussed, but car parking came up with such frequency that, you know, it was already boring. And I don't drive. I live in London, don't have a car. So car parking was always annoying. Anyway, we were in this meeting, and as a respiratory team, we'd been dealing with COVID. So it had rapidly gone from 1 or 2 cases filling our side rooms to filling our entire ward to filling multiple wards that were now entirely respiratory patients with COVID. So we were already managing multiple wards. We'd taken over some surgical wards already. But somehow the entire hospital hadn't quite clicked just how bad it was. And we were in this consultant meeting and people were talking about car parking, and I just lost it. And I said, have you any idea what is happening? We are running multiple wards. We are in at 7:30 every morning trying to crisis manage how on earth we're going to manage all these patients. We're talking to ITU. We're in late every night. Like, what are you talking about? We need to stop talking about car parking. And it went down quite well. And the next morning, suddenly, all our colleagues were right there. And we had dermatologists and rheumatologists saying, what can we do? And it was really amazing to see that huge upswell of help because they got it. I was like, thank God.
Thank you. I'm going to go just to the next quote, which I hope everyone can see. It's just a written quote. So it was interesting for me because a lot of people talked about SARS and MERS when they were talking about how the virus was coming, how the virus was spreading, but obviously mostly within a UK context. So in a UK context, SARS and MERS is, we're really scared, it sounds bad, but it didn't take hold in the UK. But this was an interesting quote, I thought, from somebody, one of the interviews who grew up in Singapore, just talking about the impact that SARS had had on her childhood when she was doing her A-levels. And I didn't know whether Ajitha or Tuk, you wanted to say anything about how important consideration of SARS and MERS was in your sort of early response, or whether, like, Laura Jane, you had any sort of disagreements with colleagues about how serious it was going to be?
So I remember the SARS and MERS, and I think most of us remember the press and the global press around it, but it kind of never affected the hospitals, and it felt like, oh, it's another SARS, MERS kind of thing. When it hit Italy, I think we knew that it was coming our way, but I think for a long time, I think myself, and I wasn't the only one in my hospital, thought, no, this isn't going to come, because we were hearing the reports from Wuhan. Where it clicked for me that this might be a problem, and I wrote it down, I don't keep a diary, but I wrote something down on that day, and I sent an email, I think, to someone at work. The 30th of January, shortly after Chinese New Year, we had a couple of patients who had come from Wuhan back to the UK, so UK citizens, and they'd had a cold, and they just pitched up in our A&E because they had been in Wuhan, so they obviously were experiencing that. And at that time, we were running a respiratory and reach service into ED, and I was in ED, and there were like about 10 different managers in the department. I'd never seen so many non-clinical people in the department. And I said, what's going on? Oh, we've got 2 query COVID patients, and they were in the side room. And so I actually had to, they weren't fit testing or anything, so I was in the whole hazmat. There was me and a junior doctor fitted up. I've never worn a hazmat before, and I wish I'd taken a photo of myself. And we went to assess the patients, and they were fine. We'd swabbed them, and we sent them home, telling them to stay at home, and then we called them. I think at the time it was a 5-day turnaround to get the results. So fortunately they were negative. But I remember emailing, because it was when I was in my senior management role, I emailed various managers saying, what's our policy? Do we have a policy? Does everyone know the policy? And I think people, like, I was at a management meeting and people were talking about vascular services the next day. And I thought, no, we kind of need to know what we should be doing if this does come to our hospital. It took us a while to catch up.
Thank you. I'm going to move on to the next slide, but Tuck, you're high up my list of the next person to ask. Obviously you were feeling, had different feelings at this time. I think there was a really strong narrative. There was definitely a really strong narrative in the public that healthcare workers were were heroes. And I just want to play this little quote from Ajitha's interview in response to that.
When you train, when you're an undergraduate and then when you become a doctor, at no point in your training do you think, I could be in a situation where I could be looking after people where I could then become ill and contract that illness and die. You're taught when you do advanced life support, if you're out on the street, you don't put yourself in danger, even if you've got a patient who is arrested and they're in a dangerous situation. Even though you're a doctor and you've got the training to deal with it, you don't put yourself in that situation. That's what you're trained. But then suddenly that was kind of all flipped around, because you're suddenly being told as doctors and nurses, you have to look after this patient. You could, if you contracted this illness, die. I find it quite strange how a lot of non-medics in the wider population, I don't think they really understand that. It's not a risk you're ever told about as a doctor or a nurse. Your profession could put you at increased risk of harm being done to you.
So, Ajitha, I noticed your quote, but I'm going to come to Tuck first, if that's okay. Do you have any reflections on these thoughts, Tuck?
Well, I think a lot of my thoughts and reflections echo all that my colleagues have said so far. And at that time, when you're right in the middle of what now seems to be a tsunami, at the center of the earthquake, you're not really thinking about, the gravity of the whole situation or what the consequences would be. You're just there and you do your bit. I distinctly remember, I work in the southeast, and we were somewhat cushioned in the first couple of months from what we were seeing in London and other major inner city hospitals. It brought back the urgency of the situation when I had a call from our chief of staff from the surgical and anesthetic directorate, and he was asking me, having heard what's going on in Italy and how they ran out of oxygen and the wards and the intensive care units were completely overfilled. He said to me, Tuck, how many ventilators, do we have enough ventilators to cope with what we need? And ours was a district general hospital, and I said, no, you will never have enough. And that memory still haunts me today, thinking that was the only time when I felt this is actually very serious, but we were seeing it coming towards us, but it hadn't hit us yet. But I think people don't think, or I certainly didn't think about how it would affect me. I just thought, we have a job to do, that's what we're put there to, and we'll do our very best. I suspect most people in the NHS work to that ethic.
Thank you very much. And Catherine, in your interview, you talked about heroes that people would just never have known were there. I don't know if you want to say a bit more about that.
Yeah, so every day in North Tees, we stood up what was called a clinical decisions group, where you got all the right people in the room that could make decisions very quickly. I can still remember the day we've got no more oxygen. We literally, if another patient comes in, we can't ventilate them, we can't BiPAP them, we can't CPAP them, we've got no more oxygen. And so from all the people in that room, the things I remember the most are the guys that stood outside in beautiful sunny Teesside, hosing down the oxygen cylinder 24 hours a day, 7 days a week, because oxygen freezes, which I do vaguely remember from chemistry, but liquid oxygen freezes, so to stop that from happening, they hosed it down. Or the logistics, the estates guy who said, we need to bring the cylinder from the big big cylinder, I don't even know what you call it, the big liquid oxygen tank from Hartlepool. We need to bring it, and that completely saved our bacon, or the bacon of the people of Teesside, really. So they transported it. That in itself was a logistical nightmare. All the people that facilitated that, like, they're the heroes of this. They went way above and beyond what they would normally do. The porters, they were like, oh, I'll go up to the Nightingale and get the extra CPAP machines because we'd run out, and so literally just went in their own time and picked them up. The dinner ladies who came in anyway and were cheerful and set up a little stall for us so you could buy toilet paper and all the stuff that seems beyond ludicrous now. They did that for us and to support us, and most importantly to support our population, but nobody really talked about them, I don't think. Not that I remember.
Thank you. And Ajitha, this is your quote. Do you have any things you want to say before we move to the next topic?
I echo what both my colleagues have said here. And so I think at the time, it was, you just got on with it. At the time of the interview, which was, I think, March 21, there'd been a lot of personal reflection, and I'd had some non-COVID health conditions following the end of the first wave, and I think it made me think, actually, if I'd known about these conditions, how would I have felt? So, yeah, I mean, at the time, I mean, there was a bit of excitement, I think, you know, when it did come to us, it was like, wow, because we'd almost been waiting for it because you'd seen what was happening on the continent. And when it came, it was like, yes, we don't have a plan, but we're going to do what we can, and, you know, we'll do what we need to do. And then, yeah, at the time of the interview, I was like, wow, you know, this is what we all put ourselves through. Because I think also by that time, most of us knew colleagues within our hospital who had passed away, or you know, had been very, very sick on ITU. I had some very close colleagues who were intubated, and you did think there, but for the grace of God, you know.
Yes, of course. Thank you. And something else that quite a lot of people said in their interviews, which again really surprised me, it was a surprise, was that you actually felt kind of guilty that you were going to work because so many other people had to stay at home. Laura Jane, I don't know if you want to comment on that.
So while it was stressful and difficult and uncertain, and particularly seeing colleagues getting sick and worrying about that was very difficult, the fact that we had our normal routine was actually really important. And so going to work every day and feeling very purposeful let us off the hook a bit in terms of what other people were experiencing. And my partner was at home and, you know, would go out for his walk every day that was allowed, and that was it. And there were lots of people having a very difficult time, completely cut off from all of their normal support mechanisms and their normal life. And we at least had this sort of weird normality. So yeah, that was a bit of an odd comparison.
Thank you. So obviously I think part of it was that the public needed you guys to be heroes because we sort of needed you to be there to look after us when we got sick. But you were not just coping with that expectation and your own concerns, but also as consultants, you know, your junior colleagues who were looking to you to lead the way, in a sense. So the next two quotes are both about juniors. We did interview juniors and we did invite people to come, but I guess because of rotas, no one was able to make it.
Medicine is quite hierarchical. I noticed that some of the hierarchy became less during the pandemic, and I think that was part of the support network. And for the junior staff as well, I remember speaking to them a little while afterwards, and one of them memorably said to me, the thing that concerned him the most was seeing the grown-ups look scared. And that was interesting because they were looking to us for guidance, but they could see the fear in our faces as well. And I think they found that really disconcerting because, as I say, medicine is normally so very hierarchical.
And then the next quote, which is from he was a foundation year 2 at the time, working in intensive care in Manchester. And these are the just reflecting the quote from before, saying, you know, we were trying to get all our PPE off after coming out of intensive care, and we've been told, this is a very early stage of the pandemic, we've been told that it was 50% mortality, undifferentiated. And he said the intensive care consultants were usually so calm, you know, in desperate situations, managed to stay so calm, but when trying to get off the PPE and following all the rules, just looked incredibly anxious. So yes, he was reflecting the comments above from Sophie Fletcher. And I'm just going to play one more. This is somebody who was called an interim doctor. So he actually accelerated through his last year in medical school to come into helping on the COVID wards as a very, very junior. And he's talking about how it affected training.
Really, really strange time to start working. For other colleagues who I mentioned who are on respiratory wards and coronavirus wards for maybe 8 months of their 12 months first year of starting, if you think about them, they've had no variety in training. You know, treating coronavirus patients it's not varied or interesting in the end. You can do your job well, you can communicate with patients well, that is your job as a junior doctor, but it's just patient after patient, the same thing happens. And the variety of training, for me, I've been lucky, but the variety of training of other doctors, I imagine, you know, is hugely reduced. Just see the same thing. There's no diagnostic questions. You know what the diagnosis is, you know, and that's not necessarily why you become a doctor.
Tuck, I don't know whether you'd be okay to comment here, because you talk a lot in your interview about supporting juniors and working with juniors, to comment on how the pandemic, you think, impacted on their training. You had a lovely quote in your interview. It said, it's given them, in a very bizarre and surreal way, a very good exposure to the fragile nature of life and health.
Yeah, it's, I think with time that has passed, quite a lot has changed, and often we revert back to the norm. What I think back about of those early months was how, you know, most of the time when there is a situation which requires a certain level of discipline and efficiency, the goal command in the NHS kicks in. So you could only do certain things, and you could only perform in a certain way and wear certain things, or say certain things. And I think this was very interesting, juxtaposed against people who were on the front line working. And I'm so terribly proud of my colleagues who were training, because all of them, when I worked with them, went above and beyond what they would have done. And I don't necessarily agree that you didn't learn about medicine. In fact, I think the art of medicine was the key bit that myself and others learned. Because there were no drugs, there was no cure, there was, on the face of it, oblivion. All we could do was to be there for our patients. And I think perhaps one thing we could have thought and taught better is how we could be caring. If there was one thing we took away from that, was our capacity for care. And I think hopefully, when I'm very close to those people that the F1s, the registrars, I still have chats, drinks with them regularly, and I think that forms a bond that you will never break because of those very personal experiences that we had to go through.
Thank you very much. And actually, lots of the juniors talk about feeling very supported through this period as well. And, you know, that there were always people around that they could ask and find support from. I don't know whether anyone else wants to comment on working with juniors through this period.
I think the kind of the flattening of the hierarchical thing was was obviously absolutely necessary, but it came about because all our elective work was cancelled. So we were on the wards as much as our junior doctors were. And, you know, in the mornings, we would all be, there'd be a period of time where we would all be getting our PPE together. And there was, so we were with them struggling to get our masks on and have we been fit tested. So their experiences were our experiences for those months that we had the pandemic, which we'd never probably experienced before since we were trainees, and they'd not had that before.
Thank you. Thank you.
I did feel a lot of pressure to like be in charge in a situation in which we didn't really know what to do. Because you could see the juniors really looking to you. And the only thing we could really bring them was consistency and care. Yeah. So we protocolized lots of things quite early on because it wasn't complicated. The actual medicine was very simple. But that kind of protocolizing and being really clear and structured on a ward round gave a lot of sense of security. And then just like really explicitly just caring that people were having a bad time and that this was hard and talking about that. And that was really all we could give. Otherwise, we were all learning together. That was the other thing. So people were sharing papers they'd read and stats and things that they were getting from Italy. And so there was a lot of sharing of new data across the hierarchy, and it was new to all of us. So that was a very unique experience. It wasn't us passing on some long-held knowledge, you know, from the back in the time of old-time medicine. It was very much, oh, I read this paper. Have you read this? Oh no, I haven't got to that yet because I was here for millions of hours. Thanks very much. What does it say? You know. So that was really interesting and very positive, I think.
Thank you. And sharing on WhatsApp, which was another thing that surprised me. I just, for some reason, didn't expect you guys to be sharing things on WhatsApp.
Yeah.
But yes.
Can I just add one thing which I thought was really important? I like Laura Jane, felt a distinct sense of responsibility in that I remember saying to some of my team, you are probably the safest you can be, and my job is to make sure this is the safest place you can be, because there was distinctly the COVID wards and the non-COVID wards. And on the COVID wards, you were completely masked up to the hilt when we got the PPE. I said, you've got to remember that, you know, if you're not careful, we are the chink in the armor. If you get ill, you'll pass it to the rest of us. And if you don't come to work, then obviously there'll be less of us to do what we have to do. So there was also that weight of responsibility to say, we've got to stay well if we're going to get through this.
Thank you. So to move on to picking up a point that Tuck made about we just had nothing, we had no medicines in that first wave to treat people, all we could do was be there. We did interview a lot of palliative medicine specialists, and I wanted to play this clip with a palliative medicine specialist working in Brighton. It's a bit long, but he talks really quickly. So
there was a routine where we would literally walk around the hospital all day, making sure people are okay, you know, going to every ward, whereas normally we wouldn't do that. We'd go where we were needed or go where the referrals were. We made a point of going to every single ward and actually physically just saying, are you okay? Do you need help? You know, you will have dying patients on this ward. You know, we can see them. We'll take some of that burden off you. You know, have you spoken to relatives? Do you know how to do this? Because by this point, everyone was doing it on sort of FaceTime or phones. There was no visiting. There was no face-to-face. You know, clearly it was sort of, you know, a bit rearranging deck chairs on the Titanic at that point. But also it felt really important that that's what we were doing. That was our role, making sure that people knew that it was perfectly acceptable to palliate people too. Because I think some of the danger through it, certainly after a month or two, was actually, oh no, you know, people shouldn't die from this. And actually it was like, when you look back, yes, people died before, you know, they might have otherwise, but at the end of somebody's life, you know, an overwhelming pneumonia is what kills people. My standard mantra is that most people are over, not undertreated at the end of their lives. So once you're in hospital, it's very difficult to take a step back and go, we should stop. You know, we're doing too many blood tests, too many things. We're not improving the situation. I think people were much more readily able to recognise when somebody was going to die. And I think that changed the culture a little bit. You know, if there's one mild positive that comes out of this, it's actually recognising that, you know, sick people in hospital do die, and hospitals are a place where people die and will always be a place where people die. And there's nothing wrong with that. You know, assuming no one's made any mistakes, if someone's coming to the end of their life, then good end of life care is an integral part of hospitals.
So, Catherine, I don't know whether you'd be willing to come in here, any reflections on these comments, or on whether attitudes towards palliative medicine have changed in hospitals as a result of the pandemic.
Yeah, so like Ollie says, we had our palliative medicine team coming in every day, 7 days a week, which was new, a massive, massive change for them. They were heroes from the pandemic as well. They came in every day, not just to support the patients and the families, but to support us as well. They were a real help, because by definition, pretty much all of their patients die. And as an acute respiratory physician, obviously a lot of my patients died too. But having those people to kind of bounce ideas off, shoulders to cry on, coffees to have with, I found really, really helpful. And they were very good around and this, I'm going to try not to get emotional, the people saying bye to the families on iPads. That was, for me, brutally, brutally hard. Like, in the first week, I'd gone up to see my friends and the nurses and everybody on the respiratory ward, because I was mainly in acute, and they were literally holding an iPad for this lady to say bye to a family. And I was just like, oh my God, this is absolutely not how we do healthcare. This is not how things, you want things to be. And I never got hardened to that, because there's a danger that you do, where you're just like, right, room 8's die in room 9. You've just got to be really careful. And I think palliative care were really, really good, certainly in our trust, for that kind of emotional support. They did a creative writing thing, which is not my cup of tea at all. But for a lot of people, doing that creative writing was really helpful, and that was led by the palliative care team. So they went above and beyond, and some of them, I think, suffered for it afterwards.
Thank you. Would anyone else like to comment?
Our palliative care team were amazing, and quite quickly sort of really recognised the importance of their role, and recognised that a lot of people were going to die, and we needed to do that as well as we could in very difficult circumstances. So they did really practical things around symptom control, medications for people who were very breathless, because breathlessness is such a frightening symptom. And we would have people on, I mean, our respiratory ward turned into a high dependency ward. We were looking after patients we would never look after. They'd always be in ITU. And yet there they were, and we were full of them. And so these are people on ventilators, on the maximum amount of oxygen, still breathing really hard despite everything we're doing. And so trying to manage that level of symptom was really, really key, and the palliative care team were amazing for that. But that thing of iPads and phones is just like, it still gets me. Yeah. There was one patient in particular who I talked about in my interview. There were 2 sisters on the ward, and like a lot of people, whole families were affected. And so we were seeing whole families in hospitals. So there were 2 sisters on the ward, and on one day we sent one home, and the other one just deteriorated over 24 hours. And she really didn't want to be intubated because another family member had been intubated and had died. And so in her head, intubation meant death. And we were at real pains to say, no, we're seeing people get better. We can't go on as we are. You're tired out. We can't. And we had to help her use FaceTime to speak to her daughter and her sister, who'd gone home, on FaceTime before we intubated her. And I can like vividly picture the scene, because there was me and the intensive care consultant like holding this phone for this woman who was self-proning, so she wasn't even like in a comfortable position to be on the phone, like saying, oh, I'll see you soon. And then she was intubated and went off to ITU. And I checked each week to see if she was back on the ward, and she never made it back to the ward. And so that scene of her talking on the phone with us holding up an iPhone, and her, pouring her heart out to her family, and just seeing their little faces on the screen is just, like, that is one of the standout moments from the entire thing. And that, like, really encapsulates that first wave and just how awful it was, and how we weren't prepared for that, because how can you be?
Can I just ask you a question though? Do you think it would have been worse or better if we'd have known that that's what it was going to be like? I don't know if there's an answer to that. I don't know if I would have run a mile if I'd have known it. I don't know.
Yeah. I don't think there's any way, I don't see how we could have prepared
No.
for that level of emotional trauma. I don't think you can prepare for that. You just sort of have to try and get through it.
I think it took a lot out of healthcare professionals after the event, because part of us, some of us felt that we had to be the families, the loved ones for the patients that they didn't have. And that was very difficult. And there's only so much as an individual you can give before it starts to really impact on your sense of emotional well-being. Maybe that will come out later on.
Yes, yes. I'm going to move on to the next. Jitha, I realised that we need to bring you in very soon. Talking about families, actually, but looking after, not just trying to reach the families of your patients, but looking after your own families as well. So this is from Tuck's interview.
In the end, I was away from home, staying alone for 5-6 weeks. I have a young family with 2 young children, and everyone was very worried how this would affect young people and particularly children. So I remember what my wife and I saying, well, okay, maybe the safest thing for me to do is to stay away until we understood a little bit more about what was going on. We were very fortunate. One of my friends happened to be able to let me use their facilities, their house in the neighboring village, which was not far from where I work. So I ended up sort of waking up, getting to work, spending a day at work, and then I could come home to an empty house and wash and just rest. And then the day began again. It was 7 days a week then. And I didn't have to worry about, spreading it or passing to anyone. As the weeks went by, I would pop by and stay by the gates of the house. So they'll see me, but we didn't really have any close contact at all. No hugging or kissing or anything of that matter. And yeah, that was hard. That was hard on many levels. But in my case, I think I immersed myself in work and just thought, I just have to stay safe. I have to keep my patients and my colleagues safe, and we'll get through this some way. I just had no idea what the future held. I think it's easy sometimes not to see how scary and worrisome the whole thing was at that time, because we were just thinking we've just got to get by week, day by day. And it's only in retrospect and looking back now, I could see that there was a lot of unmet expression or emotion that we are only beginning to see now as things start to resume some level of normality.
So, Tuck, I don't know whether you want to... that image of you standing by the gate looking at your children is very poignant to me as a listener. I don't know whether you want to or are able to say anything in reflection on this.
I think I've said all I could say on that particular incident. I think a lot of people probably have very similar experiences. I was fortunate, very fortunate, that I wasn't so far away that I could not pop by. And I think a lot of families probably had a lot more difficulties, because just coming back to what you said, where, if you have no purpose in life and you're just staying at home and you have childcare or other matters, and it all boils up within the household. And my sense was perhaps I couldn't be there to be support as a husband or father, because I was needed elsewhere. So that did bear on me later on.
Thank you. And Ajitha, I don't know whether you mentioned that your own father was very worried about you.
Yeah, I mean, like a lot of Asian fathers, it's just me and my sister. The communication usually is a phone call to mum. And for the first time in my adult life, he was the one who was calling me, and it was every day. And because everyone was seeing the stuff on the press, no PPE. So he was asking me, have you got PPE? Have you got enough PPEs? It was 80 at the time. And I was just saying yes, I was just saying the things that he needed to hear. What can you say to your elderly parents who you're not seeing? Because neither me or my sister saw my parents for about 6 months in the end, even though they just live in Essex and we live in London. And you just have to reassure them that you're okay. Don't tell them what you're actually seeing or doing.
Yeah. Catherine, I don't know if you want to lighten the mood a little here by telling us some stories of your children.
So I've got 3 daughters, and one of the most memorable moments in the pandemic was when I'd gone to the clinical decisions group that I referenced earlier, and it was the "we've got no oxygen" conversation. And in the middle of it, my youngest daughter was texting me going, I need to label parts of a river. Can you help me? Mum, what's this bit? What's this bit? And my phone was going ping, 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 ping. And the medical director said, do you need to answer that? And I was like, it's a bit cringe, but no, I don't. So I just texted back and said, Molly, can you stop texting us? I'm actually quite busy. Can you ask Phil, and which is my husband. And she said, no, he's busy. So he's working from home. And I'm there in the middle of this. We've got no oxygen. It's horrendous. And I'm the one that's labelling the parts of a river, which it was at the time was funny, and I look back and it was just you just juggle everything, don't you? If I'm being a bit sexist here, apologies, but as a mum, you're still like you're at work and you're being Dr. Monaghan, and then you go home and you literally get in and you're like, what's for tea? And can you help me with my chemistry homework? So you're flipping from COVID to your normal life in the most bizarre way.
Thank you.
And I don't know how to label a river, so I failed.
Thank you for lightening the mood. I'm just going to move on to the last little section, because it'd be nice to have time for a few questions, either from the kind in-person audience or people who've joined online. So, Laura Jane, this is you talking. You are the maker of our hero item in the exhibition, the crocheted COVID, which you'd made so your colleagues could punch it when they were feeling particularly stressed. But this is your comments on how you tried to distract yourself during the pandemic.
It's just been really hard. I mean, because, what can you do? There's only so many things you can do at home. On my days off, I would just always go for a walk. I'm lucky where I live, it's quite green. So we have the docks. There's a nature park and there's some woods. And so my partner and I would go for a walk around the woods and just notice things like when the allium comes out, or when the snowdrops arrive, or the fact that there's a woodpecker that you can hear. When the trees blossom, it's just like really noticeable sort of passing of time in a way that, again, is kind of bigger than the chaos that you're currently experiencing. So the fact that every year the blossoms come out at the same time. There have been some swans that have had cygnets, and then we've sort of watched them grow up and turn white, and now I can't tell which of the swans and which of the cygnets, and that's happened over the last year. Well, so there's just these things that kind of are happening separate from the chaos of our day-to-day lives is a nice thing to contrast, and to remember that although this is all-encompassing and very important right now, the world sort of ticks on and carries on, and that this won't be our life forever.
I love that. And you also told me something which I cut out, but I regret, which was you couldn't read. The only thing you could read was detective novels because they had a pattern, And actually you told me, which I also found very interesting, that they were also very popular in that kind of interwar and post-war period for the same reason. You have this enormous trauma in your life, but you can read a book that follows a particular pattern and has a specific end because, it's very predictable. I don't know whether you want to comment here, Laura, just to finish us off on ways to relax when you're going through hell.
So my cycle ride to work and back became absolutely vital and is something that has stayed with me. So initially I stopped getting public transport because I didn't want to be like a disease vector and felt like I was the biggest risk anyone would come across, since every day I was just on the COVID wards. So I started cycling, and very quickly it just became this bookend to my day that was absolutely essential. And so every morning I would cycle past the docks, past the swans, past all the trees, and get to work, and it was a little brain space, and then I would do whatever was needed during the day for however many hours was needed, and then I would get on my bike and I would cycle back, and it would be a really nice break again. So actually, because I was also really aware of how much I potentially was going to unload on my partner, so we had a conversation quite early on where I was saying, should I move out? Like, people are moving out. And he was like, don't you dare. Like, you're my only human contact. I'll go mad without you. So that, and I was like, okay, but I might kill you. And he was like, okay, well, if you do, we'll that's what's going to happen. So, but I was really aware that I potentially could come and just unload everything on him, and that was not what he needed. And so the cycle ride and just the seeing the world that was not the COVID world became vital, and there's something that actually I've kept and is still really important to me. So, you know, these days work is variably stressful. We have many crises that we're dealing with. They're not quite the same, but we have a lot of the same pressures, and that cycle ride and that seeing of nature. And I still say hi to the swans. They don't say hi back, but they do sometimes notice. Has just become a part of my necessary mental health.
Thank you. There's a lot more to say on that topic, but I'm aware that we need to have some time for questions. So I would just like to thank you all again, both for coming today and also for giving interviews, which I think will be a really important part of the archive here at the Royal College of Physicians. Oral history is the long game. I'm sorry we've clashed with the football today, so our audience is somewhat diminished, but the interviews will be in the archive forever, and I think that's a really, well, for as ever as we can make it. So I think that's, you know, a really important part of the collection, and thank you for contributing to that and this evening. I don't know if anyone had any questions that they would like to ask. Oh, Gail is monitoring the online attendance.
Yes, I'm looking after the online questions. We've had a couple. I'll just do one for just now, and then if there's anyone in the audience here who'd like to do. So the first question we had was, if you could give a message to yourself in March 2020, what would it be?
Gosh. That there would be an end. And I think I spoke about it in the interview. The day the first vaccine was administered, we saw it on the TV, but also when we had access to it where I worked, and it was December. It was such a good day.
Yeah, I think mine would be, it's going to be fine. It doesn't feel like it, but ultimately it's going to end. It's going to be all right in the end.
Thank you. Thank you. Oh, yes, we have a question here.
Yeah, thank you very much for sharing. I'm Richard Vaughtry, I'm the president of the Royal College of GPs, but during the pandemic I was the chair of the BMA's GP committee, and a lot of the experiences that you've had in hospital, right, you sort of bring back lots of memories around, you know, that initial period, sort of, you know, where it was really, really quiet and we felt really guilty. We thought we should be doing something, and then all of a sudden, you know, the tsunami hit, and sort of, and our worry in general practice was manifold. But one particular thing was about the PPE, and I think you mentioned around you were safer on the COVID ward, and actually we felt quite risky because we didn't have the PPE. We had these little pinnies and gloves, and that was it, and the face mask that wasn't adequate. And I just wondered what lessons you think you have in a hospital setting that are replicable in a community setting where we've really felt quite vulnerable as well in that situation, and yet the focus was very much on the dramatic nature of the hospital setting, where actually most patients with COVID were managed in the community.
I think what I could say, it was reflected across all our multidisciplinary work. We talked about palliative care, but I think we had a really good community respiratory team where we worked, and we started a COVID virtual hospital with them. So it just showed how it needed a really collaborative approach with our community colleagues, with GPs, but also our community nurses as well. And we were very aware that there was a lot less PPE out in the community than we had. And obviously nurses were still making visits to vulnerable patients, and they didn't have anywhere near the access that we had. And but what I took away from it is that continuing that collaborative experience, and our virtual hospital experience, which was started in the first wave, and we saw thousands of COVID patients through the VH admission avoidance, because patients didn't want to come into hospital, obviously, with COVID. And then we were sending out people very quickly, and it was that joined up working. But yeah, not forgetting how hard our community colleagues worked as well.
Wanted to make the point there as well that, sorry, to come back to oral history, which I agree is not as important as these discussions, but obviously the collection here has focused very much on physicians because we are the Royal College of Physicians, but there has been a lot of recording work done with healthcare workers in other settings, like Manchester University have done a really big oral history of the pandemic, which has included a lot of different healthcare workers and people working in hospitals. So yes, hopefully there's recorded in different settings for that. Yeah.
I just had a little comment to that. I think if it's any consolation, I think being on COVID duty every day, I think most of us will feel when we were in the thick of it, there was never enough protection, because the enemy is what you can't see. And, there are certain things you can do. There were plastic aprons, gloves, plastic bits that barely covered. I distinctly remember even the president of the Royal College saying, this is okay. And then juxtaposed to that, you see what's happening in Italy, where everyone's coming in hazmat suits. So one very interesting thing was actually feeling like you're in a whirlwind of information, because social media was rife. There was no other means of communication. So everything was out there, and someone here was saying, do this, and then wear this, or this is not enough. So I think perhaps one lesson from that may be much more of a clear steer from public health about what needs to be done very early on. May have avoided a lot more heartache later on.
I would just add to that. So the advice on what was adequate PPE changed multiple times, one way and the other. And those of us wearing PPE, full PPE all day long, every day, hated it. And it was very difficult to work in. But also when we were told that we didn't need to, we're very suspicious of that advice and where that was coming from. And I guess one of the things we learnt was that we really had to look after each other, and that although we trusted the sort of powers that be, there was a little bit of what's feeding into some of these decisions, and is this also about availability? So actually, if we're thinking about our own teams, we risk assessed, and our colleagues who had health conditions or were older or were in certain ethnic groups that we were watching be much more affected, although that wasn't part of the national narrative for a long time, we didn't put on the notice boards. So we made very proactive decisions, very hyper-locally to protect people against some of the evidence we were getting, some of the advice we were getting, because we were trying to juggle what the evidence was showing, and we're trying to be cautious. So I think that helped to bond us as a team, and was really important that we had that kind of ownership over our own risk in a situation in which it was still very unknown what that risk really was. But I totally understand the sort of vulnerability feeling of not knowing what was enough PPE and not having access to what you really felt was needed.
So we did the same in our trust around shielding people once you realised that they were potentially more vulnerable. I think we were relatively lucky, if lucky is the right word. So Teesside's obviously an area of a lot of industry, there's a lot of asbestos around, and as all those businesses shut down at the start of the pandemic, they came into the trust and they fit tested us. So I had, like you've seen the picture of me on the kind of opening slide, that's me in the PPE, and that's like industrial grade from all the asbestos removal firms. So they were absolutely amazing, and we felt pretty safe. But it's really interesting because you're right, because then you got a bit, not blasé by any stretch, but you're like, I don't want to wear it. It's really hot, it's really uncomfortable. But we never ran out, and I think we were pretty lucky actually. But I appreciate your comment. I think it was much more difficult for primary care. Our community services, we've got a very strong community respiratory nursing team, and they felt vulnerable, and we completely understood that. It was difficult.
Any last questions, or do we need to? Yes, maybe one more from the online contingent.
So the next question we have online is, are there things you learned during the pandemic that you bring with you into your life today? Changes that you made in how you connect your patients, for example, or personal changes as well?
I don't think I've ever been more glad when face-to-face consultations came back. I absolutely hated telephone consultations with a passion, and I've really tried to go back to face-to-face. I don't do clinics as such anymore, but when I did, when the pandemic was over, we did keep some telephone at the patient's request, so that does work well. So I do quite a lot of airways. So like the younger asthma patients, they don't necessarily want to come in to clinic, and I think that really, really helped. I kind of had taken that on as well, but generally, just the resilience that you've got. Like you look at yourself and your colleagues and your teammates and you think, yeah, we're pretty tough people, aren't we really? We survived that. We pulled together as a team. We did fracture at times, as everybody did when the pressure was really, really high, but we came through it well. And I don't think I've ever been more grateful to work with the colleagues, friends really, who I work with, and I appreciate them way more than I ever did, and I already appreciated them.
Thank you, Catherine. Anyone else? Things that you learned? Tuck, you were telling me earlier when we were drinking tea about just living in the moment and appreciating life a little more.
Yeah, I think it's taught me that life can be, as we all know, very fragile. One moment you're sort of going out partying, and then the next moment everything shuts down, and then everything becomes so much more living in the moment. So I think I've learned personally to be I try to be anyway, less conscious about what comes in the future and just much more present, because some of the recollections today, you speaking to someone, that may be the last chance to talk to that person, and those moments matter. I think one thing I would say, I also abhor telephone and virtual consultations, and I really find if there's a chance to go back and say something and communicate that to someone or the patient properly, it's worth the time. Because sometimes during the time when there was nothing else, there was no medicine, there was nothing to, every day was the same. The only thing that held doctors, nurses, patients together was talking to each other. And despite wearing these crazy, FFP3 masks, and sometimes being able to just touch someone and feel that that's human, I think that's what we took away from that experience. That ultimately, we as humans are very much people who need to feel that contact.
Last question, do you think? Yes, thank you.
Thank you. I'm a retired paediatrician and was very lucky. I was a voyeur of all that was going on during COVID, sitting in my garden in West London when we had beautiful weather that spring. But I have a link with Imperial, so I watched the weekly reports as the intensive care beds went up from 90 or something to 300. And I was just so terrified for all of you guys as to what was going on. But when that first wave was over, and in theory things went back to normal, what struck me was suddenly the pressure changed, and rather than you being given space and time to have a bit of holiday, to relax, to recover from all of this, suddenly I could see that the pressure was on. You weren't meeting this target, you weren't clearing waiting lists. And I just thought, this is unbelievable. How could people do this? Or am I wrong? Was it good to go back to the normal pressures of the health service?
I think that's a really good question, and actually something that I wanted to finish on, but we didn't really have time, was, have we moved on too quickly? This time to reflect or to think about COVID. I think everyone just wants to put it behind them completely. Yeah, absolutely. Ajitha, I noticed you nodding your head vigorously.
So I remember very clearly when the first wave finished and we had a Teams online meeting about elective work, recovery of elective work. And I was a senior non-clinical manager in that meeting. And it was, I think, about July time. And I was also responsible for the rotas at that time of my team. And I said, well, look, we're going to have to plan some leave. People need leave. No one's had any holiday since February. And he was like, but we've got these clinics. And I was like, no, people need their leave. Had it even occurred to him that actually we might need to take some leave, and everyone was going to have whatever leave they wanted. There was going to be no, from my point of view, that's what I was saying. Whoever wanted their leave, they were going to have it. There weren't any restrictions. That was one thing. And this second thing about, yes, we've moved on, and we've had to move on because elective pressures, but we're still paying the price. Where I work, our intensive care colleagues have really suffered, and we're still feeling that. And across, I'm sure that's across nationally as well. So we haven't been given the chance to have a break, and we're still paying the price, I think.
I did feel, to some respect, I was quite pleased that elective clinics opened back up, because I was quite worried about some of my patients. Like the quotes in some of the galleries are from me just saying, I did worry about them. Some of my long-term patients, one of them died and nobody dared tell me she died, and I'd gone on holiday for a couple of weeks, and then I'd come back and I knew she was on intensive care and she died, and I did worry about a lot of them. And what really struck me, and I think I said this in my interview tonight, they're worried about me. So when we open clinics again, they'll be like, oh, Dr. Monahan, I'm so glad you're still alive. I've been worried about you, and I heard you on the radio, and I'd seen you on the telly, and I'm so glad to see you again. And so it did feel really good, but then it didn't feel good getting the emails, our RTT is terrible, you need to do this, can you expedite? And you're like, yes, but no, because there was no mental break at all, like you said.
There was a moment where things like appraisal got cancelled,
Yeah,
audit got cancelled, governance got cancelled. We're all like, you know what, this is good.
Yeah.
And then very quickly it all came back in again. I think one thing that has stayed with us is a better, or certainly for me, is a priority for leave. So I didn't take any leave, and it built up, and I had to sell a bunch of it because there was literally no time to take it. Like there was no way I could take any of it, and that was not good. And that is, that did not do me any favors. But there was literally, it wasn't possible. So I've prioritized leave a lot more now, and I think we all have. And the other thing that really stayed with me was the disparities and the different ways in which people experienced the pandemic. So I remember distinctly when they said people couldn't sit in parks, and whereas some people had gardens and were having an all right time, I was very, very aware of my patients who live in high rises, and who the first things I did is to donate to Women's Aid, because I just knew that when lockdown happened, that there were so many people who we care for who were going to have the worst times of their lives. And I think that has really stayed with me, the fact that although we experienced the same pandemic, we did not have the same experience depending on where you sit in our society. And that has not improved, and is something that we are still dealing with, and the after effects of just the massive hit people took physically, mentally, financially, we're living with for years.
Any No more online. Any last things people would like to ask before we finish? In which case, a massive thank you again for everything, and thank you for coming. And I think, can we have another glass of wine? No more wine. Never mind. Well, thank you again for coming, and yes, and thank you to the panel.